that's sufficient for the body's needs.
During the light breathing activity, I will explain how to breathe through your nose using your tummy muscles while you are standing, sitting, or lying down.
Second thing is we want to teach good lip and tongue posture so that whatever function that the child's going to be doing, whether it's chewing or swallowing or speaking, the tongue is in the right place to begin those movements.
Start this activity by placing the tip of your tongue just behind your front teeth, where the roof of your mouth.
And then lastly, we teach about swallowing, because that's a very basic function that can work against the way the teeth come in and often works against braces too.
To begin, make sure the tip of your tongue is on the spot. You will need to make sure it stays there while you swallow.
By teaching good breathing, lip posture, tongue posture, and swallowing, we set the trajectory of growth in the right direction.
The MyoBrace appliances work by teaching your tongue to rest in the correct tongue resting position. Breathe through your nose normally and swallow the right way.
People ask me all the time, when do you start? And for most people, their thinking is that it has something to do with the teeth. The premise behind this kind of treatment is you start treatment when you discover that poor habits that are going to create problems, and you address the habits, not the teeth. It's a very different way of thinking.
Yeah.
So now we're trying to look at the reasons we're getting sick, and there's a lot of work being done in both medicine and dentistry looking at these root causes and trying to deal with them. When you consider the fact that just a few hundred years ago the teeth were not crooked, it can't be in the genes. Genes don't change that fast. Our genetic structure now is the same as it was 20,000 years ago. So it's not really a genetic phenomenon at all. They call it epigenetic because our genes are being triggered by the interaction with the environment. And again, we're talking about things that we're eating that our bodies never had to eat before, things that we're breathing that our bodies never had to breathe before.
Almost every packaged food contains sugar in some form or another. If you look on the back of the packets, you will find the hidden sugar content. Here are a few to look out for. Sugary breakfast cereals, cookies, cakes and pastries.
Well, I know it's the future, just as the future of medicine has to be looking at root cause, the future of orthodontics is also going to be looking at root cause. And because we're just taking care of the symptoms and not really the problem, conventional orthodontics will have a place because it is important to look nice in our society, but it's more important to be able to breathe well and to be able to get a good night's sleep and to have good health because of it and so forth. So at least a segment of orthodontics is going to be devoted to helping children develop good airway, good breathing, good posture, and good health.